So there's a lot of sedation involved. So the drugs we give are different.
What?
So you were talking about anesthesia during an operation in theatre
Yes.
and outside. So you said anesthesia when not in a operation theatre or room.
Yes.
So what is the difference? And also anesthesia, is it only related to operating procedures, or is it otherwise also people use it for different medical reasons?
Okay. So anesthesia is predominantly used for surgeries. We want the patient to not feel the procedure that is happening. Now, anesthesia can be done outside the operating room also. There's a term called NOra. It's an accepted word in our specialty. So this is NOra stands for non-operating room anesthesia. So NOra is for procedures that involve, say, like procedures where you don't want the patient to move, right? So I'll give you an example. So say you need to do an MRI. I don't know if you've had an MRI before. Did you ever find the MRI comfortable?
Little suffocating
Yeah.
kind of a feel.
So
Claustrophobic.
Correct. It's a very claustrophobic thing. It's an imaging, right? MRI is not a treatment. It's just a procedure to find out what is wrong so that they can go ahead and do the treatment. So when children have MRIs, it is very, very loud. It is very noisy. And you need the patient to lie very still for about half hour, 40 minutes. Now it's very difficult for an adult to lie down very still like that for half hour, 40 minutes. Sometimes the children are in pain when they lie down. Sometimes they just don't like the noise, and then they are children at the end of it, and it is very claustrophobic. You can't even put the child to sleep and take a sleeping child there because the noise is so loud that the child will wake up. So MRI is one area where we use anesthesia. The other is for CTs. CTs are very small procedures, but that time also we need the child to lie very still. And there's radiation involved in a CT. MRI does not have radiation. CT involves radiation. So now if the child moves, you cannot, even though the CT will take you like all of a minute, the child moves, you cannot expose the child again to radiation. It's not safe. So to not go wrong, sometimes the children will not cooperate, may need anesthesia. There are other things called EEGs, electroencephalograms, and these audiology assessments and all that require anesthesia. These are done outside the operating room. So we still give anesthesia. There's not much of pain during these procedures. So there's a lot of sedation involved. So the drugs we give are different, but they need to lie very still for the procedure, and that requires anesthesia.